Let's talk hysterectomies. The medical term hyster means uterus. Thus, a hysterectomy is the removal of the uterus. The uterus is the female organ where babies grow. The lining of the uterus is responsive to hormones released by your ovaries and hence proliferates in response to estrogen and is shed in response to progesterone. This is more commonly known as your period. Once a hysterectomy is performed, a woman will no longer possess the capability of childbearing, nor will she continue to have menstrual periods. Reasons why women have periods. Fibroids. This is one of the most common reasons I perform hysterectomies. Fibroids are a benign proliferation of smooth muscles, and it can cause the uterus to become enlarged. Fibroids can range in size from that of a pea to the size of a watermelon. Another reason for hysterectomies, endometriosis. Endometriosis is a medical condition where the lining of your uterus, as noted above, which is typically shed as your period every month, gets shut out through the fallopian tubes and implants on various aspects of your abdomen and pelvis. Endometriosis can be seen in the cul-de-sac of your pelvis, your ovaries, and even in unsuspecting locations like your diaphragm, lungs, bowel. The characteristic symptom of endometriosis is cyclical painful periods. Adenomyosis. Adenomyosis is like the first cousin of endometriosis. What happens with adenomyosis is that the same lining that is typically shed as your period invades the body or musculature of the uterus. Hence, uteruses become enlarged. Uterine prolapse. Prolapse is often described by women as having the sensation of something falling out of their vagina or feeling something down there. Abnormal vaginal bleeding. While there are many conservative ways to treat abnormal vaginal bleeding, including medical, hormonal, and other procedures such as an ablation, a hysterectomy provides definitive therapy for this issue. Chronic pelvic pain. Hysterectomy for chronic pelvic pain should be an option of last resort, as there are many entities for pelvic pain. Gynecological cancer, whether it be cervical cancer, endometrial cancer, or ovarian cancer, a hysterectomy, more commonly a radical hysterectomy, will be appropriate. Partial versus total hysterectomy. A partial hysterectomy means that the uterus is removed and the cervix is left behind. This is also commonly referred to as a supracervical hysterectomy. Total hysterectomy means the uterus and cervix are removed. As long as there is no history of abnormal pap smears or gynecological cancers, women undergoing complete hysterectomies no longer need to have pap smears. This does not mean you no longer have to visit your GYN and have an annual exam. Whether or not you have a total, complete hysterectomy or a partial hysterectomy. Nowadays, most gynecologists are routinely removing the fallopian tubes at the time of your procedure. This is called a salpingectomy, bilateral salpingectomy if both tubes are removed. Research has shown that the precursors for ovarian cancer originate in the fallopian tubes. Types of hysterectomies: abdominal hysterectomy, vaginal hysterectomy, laparoscopic assisted vaginal hysterectomy, robotic hysterectomy. Common risks associated with hysterectomies. Regardless of whether it's an open or minimally invasive procedure, common risks include, but are not limited to, the following: bleeding, injury to neighboring organs like bowel, bladder, rectum, etc., risk of transfusion. If done in a minimally invasive fashion, there's always the risk of having to convert to an open case. Infection, urinary incontinence, chronic pelvic pain. The type of hysterectomy you have performed will depend on factors that range from: number one, the indication for the procedure, pathology involved, cancer for example, patient preference, your surgeon's experience, patient qualifications. Remember, not every patient is a good candidate for minimally invasive surgery, and that can be due to things of a history of previous surgeries, ensuing scar tissue, very large uteruses, amongst other things. The type of hysterectomy you have performed will also determine the length of your hospital stay. Open procedures such as abdominal hysterectomies often involve a 2 to 3 hospital stay. More minimally invasive procedures like a robotic, laparoscopic, or vaginal hysterectomy may involve an overnight stay, or sometimes a discharge on the day of surgery. It depends on the postoperative course. For more details on hysterectomies, make sure that you check out the blog post and you can find that at AskDrAngela.com. Have a great day.